You know, I don't know too many rare diseases. FMD is probably the one I'm most involved with, and Pam Mace, who's championing this on a national level. She herself is an FMD patient. She also happens to be a nurse, and she basically made this condition to what it is as far as the interest of the medical community and as far as the pace of learning and understanding of this condition. And people like her who are pushing this condition forward. There are also similar advocates for SCAD that you'll hear about later. People like that, advocates, patient advocates, and also physician advocates are crucial, especially when a condition is not understood very well, and especially when it's not very common. So you don't have the masses kind of cheering on the science. You need specific people to kind of care about the condition. The main message I want to put out there is that there's lack of expertise when it comes to FMD, and the so-called experts, one of them being myself, are at this time still relying on, as I said before, descriptive data. And for that reason, it makes a lot of sense for patients with FMD to be kind of evaluated in a center of excellence. There's around the country, there are only a few, about 14 I believe of those. Around the world there aren't too many FMD centers, and I think by bringing these patients to these locations we can better our understanding of this condition, and specifically the main need is to understand what makes those minority of patients symptomatic versus the majority of patients that are probably not symptomatic and will never come to our attention. And once we understand that, we can target diagnostics and therapy better for those patients. And for that reason, I think we definitely need to kind of put forth collaboration amongst those centers and focus treatment in those centers.